Because we're talking about diversity and physical development, this video sort of addresses one of the categories under IDEA for deafness and hard of hearing. Under the law, deafness is actually defined. Sorry, my train of thought. Deafness is actually defined as a hearing impairment that is so severe that a child cannot process linguistic information through hearing with or without amplification. So no matter what kind of hearing aid or anything the child has, it will not amplify spoken language. And that adversely affects a child's educational performance. It's an important phrase because it's going to show up in many of the definitions that we see. So it's important to notice how much that's emphasized and what's considered a disability. According to federal law, child only qualifies for special education services if it affects educational performance. If it doesn't, it isn't considered something that qualifies the child for that. So basically, I'm just going to quickly review the structure of the ear. There are three kinds of hearing loss. As you can see with the parts of the ear, there's conductive hearing loss, and that's where the outer parts of the ear are really affected. Then there's the middle ear also. And these parts actually, what they do is they're conducting information from the outside into the ear canal. That's where the sound center is. So when information comes in, it's processed in the brain. A neurosensory hearing loss, or a sensory neural hearing loss, is where there's damage to the auditory nerve fibers or the aspects of the inner ear itself. And that inner ear is really important. It's where sound comes in, is taken in, and is sent to the brain for processing, for actually getting the information into the brain. If the incoming information to the brain is distorted, then that can be really problematic. The child can't interpret the meaning of these incoming sounds. So then you might have something called a mixed hearing loss, which is a combination of a conductive and a neurosensory hearing loss. So as you saw from federal regulation and law that was related to deafness, it's about the physical issue of the ear, that the hearing impairment is so severe that it prevents a child from processing language information, and that the physical condition of the ear adversely affects a child's educational performance. As a result of this hearing impairment, the child is delayed or has struggled with many areas of development. And these delays are attributed to a broken ear, right? The hearing loss. It's a physical problem that the child has. And so that's why in this section, I want to talk to you about hearing loss as a physical disability. It's an ear that's broken that results in all sorts of ramifications of other educational issues. But I want to challenge you about what deafness is in a completely different way that doesn't have any place in the physical disability. So we're going to sort of question that really, quote, broken ear that's a problem. Or is it just that it happens to be a mismatch between the language modality that a child has and that society at large uses, which is talking and speaking, right? Talking and speaking. in that particular sense that's not accessible to the child. So is it the mismatch that's the problem? If society at large was to use a visual language, and everybody in the society at large was using sign language and watching the language and signing and watching the language and signing, would the child have a disability anymore? No, the disability would be gone. The problem is the mismatch. The problem is that this particular modality our society uses is auditory and oral. And that's exactly where the child's lack of access lies. Lack of access, sorry. But if it were flipped and it were visual, the child would fit in just fine and wouldn't have any resulting issues or delays that a child who is deaf seems to have in our part of our education system. It would be a better fit. So if the society at large were visual, is there any place that we could test this hypothesis? Well, there is. Parents of deaf children, deaf parents of deaf children. In that case, the child's circumstances and the child's environment is very visually based. The parents are all signing around the child, and the child is able to access the information about what's going on in the environment. As one would expect, that child is not delayed. That child is not delayed in language. They're not delayed in cognitivity. They're not delayed academically. They're not delayed socially or emotionally. So that's kind of what you have. The child is still physically deaf, but that it's not that the educational ramifications of the child have become because they do have visual access. The channel is being used by society at large. Mainly their family is open and accessible. So it raises the question, is deafness best categorized within the area of being a physical disability, a physical issue? Or is it really more a language and communication issue? Is it an access issue? But the reality is more than 95% of children who are deaf are born into families with hearing parents, not deaf parents. Only 5% or less are born into families with deaf parents. So for the majority of deaf children, they're born into a situation where there is a mismatch between language of the family and the modality that's open to them for processing language information. So when we focus on a child's weakness, if that child's weakness is hearing, when we focus on their weakness, it's like that closed door in the slide, right? That's all the talking that's going around them, but the door is closed because the information can't go in. There's a lack of access to language. So this results in all sorts of challenges that are talked about because the child is not getting a language stimulation. There are delays in language development because the child isn't interacting with the world linguistically and not getting language input, not getting information. So it's now resulting in delays in cognition and in language because the child is not getting a strong first language. There are clearly then delays in development of literacy. This is the second use of language, which results in problems in academic achievement and certainly social emotional functioning. If you can't getting the information, learning how to interact and dealing with people, then you're going to have social and emotional ramifications from that. The language coming into the child's ear is approaching that closed door as opposed to approaching the open door, which is the eye. There isn't any barrier for information coming in through the eyes. If we would focus on eyes, focus on the child's strengths, then we can create easy access to language. We know this from studies of deaf children of deaf parents, or deaf children with hearing parents who've chosen to use American Sign Language for their deaf children. They have easy access to language, which results in normal language development, normal cognitive development, normal social emotional development, and much stronger literacy and academic development with English as a second language. So the question is, where do we focus? Do we focus all of our attention on fixing the broken ear? Or do we take advantage of the open door and keep the child progressing and learning and functioning at a very normal and age-appropriate level? In addition, if parents want, there is no reason that they cannot also pursue other kinds of physical and medical interventions that they want to try to get the ear as functioning as possible. There's often a really big misunderstanding as to why it's such a challenge for a child to be asked to process auditory language through their eyes, to lip read, to watch spoken language. An ear and an eye simply don't receive the information in the same way. Information needs to arrive to the brain in a way that's meaningful. The eye is just an avenue. They're always taking in information. The important goal is that the information gets to the brain in a way that the brain can interpret it. But the organization of information coming in through the ear and the organization of information coming through the eye is different. When we talk about the way an ear receives information, we're talking about information coming in and sound waves going into the ear. And all auditory-based languages, if it's English or Spanish or French or Italian or German, or any of them, are very linear in structure. Words arrive, and words arrive, and words arrive through the sound waves into the ear, and then they get processed through the brain. It's a perfect system for the ears if you're processing information through the ears. I'm going to go back to that other slide and continue on talking about this. But when you think about how you see things, you see them holistically. You don't see things one piece at a time that you're looking out for. You don't say, oh, I see that, I see that, and I see that, and then I see that. No, you see things in a much more visual, spatial way. There's a whole cluster of things that you see. You see things more in a bigger chunk. Well, interestingly, in sign language, all visual spatial languages present information in this kind of simultaneous and spatial way. Perfect. It's a great arrangement for how the eye works. So there are different sign languages all over the world. There's American Sign Language and Spanish Sign Language, French Sign Language, German Sign Language. Any place that there's an indigenous population of language users, there's a form of sign language that's been developed for that population. But they all have certain things in common. And one of the things in common is that they're a simultaneous kind of spatial way that information is conveyed. It does make perfect sense. For example, if I say a boy stands on the chair, okay, so in a linear way, I would do one piece of information at the time. Linearly, I would sign boy stands on a chair. That's not the way it's done in sign language. First, I'd set up the chair, then I have the boy stand on it. And so I have the chair is the object and the boy is the subject standing on it. And I combine that object visually, and it's all together, it's all clustered. I can grab all of that information in one mental picture. It's not set up one piece at a time. And all sign languages make this kind of feature. It's perfect, again, for how the eye works. One of the other routines the roots that we have to comprehend looks like a couple of different ways that sign language is here in this country. American Sign Language establishes normal cognition and normal language. So if you have curiosity, development of concepts, very normal language development, and cognitive development using it, which then gives the child the greater potential to be able to learn a second language of English, learn how to speak or read it or write it in a much more comprehensible way, because they already have a first language foundation. So access should be much easier. Access needs to be comfortable. It really is important to think about the ease of processing. So if you remember at the beginning of the lecture, we sort of looked structurally at some of the types of hearing loss. A conductive hearing loss that has to do with the complications of the outer or the middle ear. There are different types of surgical procedures that can be done and that can be used to open up whatever barriers or problems that are happening with that inner and outer ear. There are a number of hearing aid types that children wear. I'm sure you've seen different types of kids or adults with hearing aids. Hearing aid really just amplifies the sound. The child is already capable of taking it and processing, so it's an amplifier. With sensory neural hearing loss, the damage to the auditory nerve fibers are actually the aspects of the inner ear itself and the damage that can result due to many factors. The inner ear is really important because this is where the sound is taken in and sent to the brain for processing. If the incoming information to the brain is distorted, then that's really problematic and the child won't be able to interpret the meaning of the incoming sounds. So a hearing aid won't be accessible to them to help them with loss of sound. A cochlear implant, as in this particular slide, bypasses the damaged hair cells and it stimulates the auditory nerve directly. It's surgically placed in the skin behind the ear, and there are electrodes that are sent directly to the brain via the auditory nerve. And a cochlear implant doesn't necessarily restore or create normal hearing. It can provide useful auditory information, but it requires a lot of post-implementation therapy and mapping and family support and follow-up sessions. There's still some controversies about the procedure. It requires a lot of follow-up training and intervention that needs to be consistently carried out through the parents of the child. There also is the gamble in the terms of effectiveness. It's a major surgery. You're drilling into the child's skull, permanently eliminating any residual hearing the child may have in that ear. The surgical procedure, like a cochlear implant, or non-surgical interventions, like a hearing aid, focus on the functioning of the ear itself in an audiological orientation to deafness. What seems to be continually clear to me is that we should take advantage of the sure thing by taking advantage of the child's eyes, keeping the brain stimulated, keeping language information going in, keeping cognitive development happening, Then the parents can make their own decisions about what kinds of physical interventions, if any, that they're interested in having for their child in the relationship to the ear. If they're still signing, language processing and stimulation are still occurring, sign language is available. The decision to expose a child to American Sign Language doesn't mean that a parent needs to stop exploring other options too. To keep the sure thing going, keep visual access, keep signing. That's the bottom line here. So again, as we've talked about, is this a physical issue of a broken ear? Or are we talking about something about an access issue in terms of language?